Hi, I'm actually Amaral. Today I will be demonstrating how to do a chest tube dressing change as well as give heparin via continuous infusion. So I'm going to start with some hand hygiene. And my patient's in a good position right now. She's in semi-Fowler, so we can go ahead and get started. I'm going to introduce myself. So hi, Mrs. Wendy Holmes. I'm Ashley. I'm a student nurse who will be giving you some heparin as well as doing your chest tube dressing change. So I'm going to start with my first med check. I'm going to compare her name to her ID. So Wendy Holmes, 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. I'm going to ask her to state her name for me as well as her birth date. Okay, so Wendy Holmes, and you're 35 years old. And I'm going to compare this mark here to what I have hanging that the other nurse already prepped and primed for me. So I'm going to be giving heparin for a venous thromboembolism. So I have heparin here. It's 25,000 units within this bag. The concentration is 100 units per ml. The order is to give 1,350 units per hour. So for my calculation, because the concentration is 100 units per ml, that's going to be at a rate of 13.5 mLs per hour. So I have the right drug, the right routes via IV, the right time, it is due now. And I'm going to go ahead and start putting this into my pump. So primary, I'm going to go under the colleague guardian, select that. And I'm going to have to select heparin for VTE, venous thromboembolism. Select that. So it does match up, 25,000 units. That's a total of 250 mLs of the diluent D5W. The dose is going to be 1350 units per hour. That rate matches what I calculated, 13.5 mLs per hour. Volume to be infused is 250. So after I've already put that into the pump, I'm just going to do my second med check. So we have the right patient, Wendy Holmes. We have the right drug, heparin. The right dose, so it's a total of 25,000 units within this bag. The concentration is 100 units per ml. She is getting the correct dose of 1,350 units per ml. The rate's 13.5 mLs per hour, and then the volume total is 250 mLs. Now because the rate is so low, she is going to be getting the carrier of normal saline here that the nurse already primed and connected. So I see that this is going via gravity right now. It's unclamped, we're good to go. And I see that the tubing here is portless, which we need for continuous infusion. So now that I've done my second med check, I can go ahead and connect this to my patient. So again, Wendy, you will be getting this heparin because you did have a venous thromboembolism, so that's like clots, and this prevents any clots as well as dissolves them. So we will be monitoring you for any possible signs of bleeding, like we'll be monitoring your blood pressure, and again, if you experience any of this, your call bill will be within reach and we will help you. So I'm just going to check this for patency. I see that it is patent, and then I can go ahead and connect the heparin. And she did give us the consent for this medication. So before I hit start, I'm going to get a second nurse to check each of the rights of the medication as well as the rate that I've put within here, just because it is a high alert medication. So after that nurse has okayed it, she's done her third check with me, I can go ahead and start. So I'm going to confirm the primary, make sure that the clamps are off, and I can press start. And I'm just going to monitor. I'm going to see the 3 drops. Okay, and that's good to go. So now I can demonstrate what we will do for chest tube care. So the safety check that we're going to do for chest tubes is going to come along this way. So they need to be on continuous low suction. So I see that this is intact, it's on, it is within the low, and then I'm just going to trace the tubing And as you can see on the nightstand there is some normal saline, as well as we do have the other safety measure of clamping forceps. So again, that is for if the chest tube accidentally comes out, we can put that within the normal saline. So I'm tracing the suction tubing, and I'll get you to come this way to see the collection system. So at the start of the shift, I'm just going to measure and initial where I see the amount of secretions, and I'm going to take note of its quality. And I'm going to check that this is all intact. I do see the orange floating ball, which means it's working. It's at 20 centimeters of water. I would look for gentle tidling that coincides with the patient's respirations. Now normally this, I would not want to see any sort of bubbling because that indicates that there is a leak within the system, but because Wendy here is not an actual patient, we are going to see this. Now if I did see this within an actual patient, what I would do is grab the forceps, excuse my reach, Wendy, and I would trace this to find where the clamp is. So I would start here, and if the tidling or the bubbling stopped, I would know that it's within the chest tube. You don't have to call the physician. Otherwise, I would continue to go down until I find the leak. I'm gonna put these back.
I was explaining every tool, and I feel like I don't.
And while I'm here, I'm going to see that the dressing is intact. I'm going to palpate and make sure I don't feel any subcutaneous emphysema. Again, I see no kinks, and it looks like we are good to go. So Wendy, I'm going to go ahead and start with your dressing change now. So I'm just going to ask her to lift her arm as far back as she can go, and the patient would have them on their side as well. So then I'm just going to get my supplies going here.
Am I allowed to, like, after she does it, just, like, stop it myself as I film?
So I'm going to get this at waist height because I want this to be a sterile field.
Yeah, and then I just have to
Oh, and I'm going to ask my camera woman to get me 2 pairs of gloves, please.
Yeah. So.
Thank you.
I know.
So I'm going to set up the supplies for the dressing change. And I'm just going to ask Wendy, is it okay if I put my garbage here? You're okay with that? Perfect.
Yeah, I remember.
Everything is on plan. So.
Yeah, once she starts it, like, we...
So I don't know what. So I'll take this off.
And make sure I know where my forceps are. Good. Sort of move that. I don't need this.
I underestimated how many gloves I needed. Okay, you guys.
We were missing a cap.
It's. Yeah, I gave it on the end of there. Okay, so. That's fine.
And then I'm going to be using no-touch sterile technique. So just tip to tip, get these out of here.
We have to go relatively quickly. Yeah.
Okay, you starting over there?
I checked all the time. I clamped it. Yeah, once you press it, we just hold it.
Alright, ready? Yeah. 3, 2, 1, go.
And add my normal saline.
Demonstrating how to administer TPN via CVAC and doing trach care and safety check for trach. So we have Fred Frederickston. I'm just going to pretend we're
I'm gonna add
in
some
the
drain
room right now, and I'm going to
sponges.
check my bag for my TPN. So the infusion order and my rep.
Butterfly the
So I have Fred
package back.
Frederickston, right patient.
And I have
Right drug,
2
we're doing
sponges
cardiac
here.
nutrition, Initiate TPN adult infusion, perfect. I'm going to check here that I'm doing 2,000 mils continuous over 24 hours, and my rate is going to get 83.3 mils
And
per
add the
hour.
jello net as well.
And they ordered amino acids, 100 grams, 200 grams dextrose, and 50 grams of lipid, and that's correct. Specific to this patient, sodium 120 millimoles, potassium 60 millimoles, and I'm going to check this with the bag. So,
Okay. So now I'm going to don some clean gloves
right drug,
and get rid of this old dressing.
2,000 mils, and our formula is amino acids, 100 grams, dextrose 200 grams, lipids 50 grams, and our electrolytes are sodium 120 grams, 20 grams potassium 60.
So now in a patient, the chest tube would be stitched in, but because it is not stitched in, I'm just going to make sure I stabilize it while I'm taking out the old dressing. Okay, just put that in my garbage.
Done. We have the right route. We're using TPM.
I'm going to use some forceps to get rid of the old jello net.
Right time. It's due right now to start.
And then just discard these. And then while the stoma is open, I'm just going to assess it. I don't see any redness. I don't see any signs of infection, so we're good to go. So I'm going to get rid of these old gloves. I would do some hand hygiene and apply some clean gloves.
So I'm going to program my pump here. So we want to option it. Primary, change mode.
Okay.
Label line. Go down to nutrition. Our rate ordered by
So
the
with some
MD
florets,
is 83.3 mils.
dip it in the saline, and then just go on a gentle circle, one swipe per wipe, and discard. And continue that until I see that it is clean.
CVAD for patency.
Another
We're going to
floret.
use the white lumen. They're all the same size here. And I want to reserve the maroon
Go
lumen
in a larger circle.
to be done throughout the day for this patient.
And then an even larger circle.
So I'm going to put in mine.
And use one of my 4x4s to clean the chest tube as well.
And I'll just keep that on for a moment and I'll clamp it off so there's excess pressure in the line. And I'm going to do my second med check before I hook them up here. So right patient.
Clean the tubing. Now I'm going to dry it off.
Nutrition. Again. Macronutrients, 100 grams amino acids, 100 grams dextrose, 50 grams lipids. Yep. Electrolytes are sodium 1 gram per millimoles, potassium 60 millimoles, phosphate 10 millimoles, magnesium 10 millimoles, phosphate 50 millimoles, multivitamin 10 ml, trace elements 1 ml, and added chloride for 158 millimoles. So everything is ready to begin. I'm going to hook my patient up here. And everything's all primed and ready to go. My filter is all primed.
The stoma has been cleansed and dried, so now I can go ahead and apply my jello net.
Second nurse to verify
I'm just
that
going to
I've
peel
put
it
everything into the pump
off.
correctly, and she'll do the same med checks that I did. So right drug, right patient, right composition for this patient. And he has consented to this procedure. He understands that because he's not taking anything in.
So I'm just going to fold it over a few times so that it can fit nicely
Enteral nutrition
around the
as he's
stoma.
going to be getting it. So my second nurse would come in, she'd check everything I did, the rate,
Okay.
the
I'm going to wrap it around
total,
the
and
stoma.
then we can press start.
And I've cleansed this site, so it's okay if my forceps touch it. And then I'm going to grab some
We can see that there's
of the drainage sponges here and apply them in 2 different directions. So that's one. And then in a different direction.
So we have the same patient here, so I've organized
And then grab one of my 4x4s to place on top.
First I'm going to do a trade safety check So I would be wearing a mask for all straight hair. I'm going to check that my section
Okay,
is on.
and now I can go ahead and apply my knee fix dressing on.
120, and we are at 100 right now, so that's good. I'm going to look at my oxygen here. There's 60%.
So I'm going to want this to be fully occlusive.
It would be at 10 mil or 10 meters. Because it's so loud, I'm just going to turn it down
For the dressing.
video.
And another one with my date, the date and initials.
I have an extra trach tube, I have dilators, I have extra trach ties, I have an extra disposable.
So again, this is going to be fully occlusive. As well, I'm going to tent the chest tube, just in case the patient accidentally pulls on it. It will pull on the dressing and not the actual tube. So that's tented, and I see that it's fully occlusive. So then I would place my patient back in a comfortable position with the call bell within reach, and I would document the procedure and how she took it. Thank you.